anxieties once again. Human Metapneumovirus or HMPV is not a new virus. It was first discovered in 2001 and is part of the family which also includes the respiratory syncytial virus or RSV. HMPV is a common respiratory virus that infects people of all ages. However, it poses the greatest risk to young children, older adults, and individuals with weakened immune systems. HMPV spreads through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people nearby. Transmission can also occur through direct contact with contaminated surfaces such as toys or doorknobs. The symptoms of HMPV are similar to those of other respiratory infections, including the common cold and the flu. Infected individuals may experience cough, fever, runny nose, sore throat, and shortness of breath. In severe cases, HMPV can lead to bronchiolitis, pneumonia, and respiratory failure. There is currently no specific treatment for HMPV. Treatment typically focuses on relieving symptoms and supporting the respiratory system. Over-the-counter pain relievers and fever reducers can help alleviate discomfort. In severe cases, hospitalization may be necessary to provide oxygen therapy or mechanical ventilation. The current outbreak of HMPV in China is raising serious concerns, with reports of hospitals overwhelmed by a surge in patients. Social media posts and news reports paint a grim picture, showing overcrowded hospital corridors and long lines of people waiting for treatment. While official data on the outbreak remains limited, anecdotal evidence suggests that the situation is serious. Adding to the anxiety are reports of increased activity at crematoriums, fueling speculation about the true scale of the outbreak. While authorities maintain that the situation is under control, the lack of transparency is doing little to quell public concern. The Chinese government, still haunted by the memory of the initial COVID-19 outbreak and subsequent criticism of its handling of the situation, is facing pressure to contain the HMPV outbreak swiftly and transparently. However, the lack of a specific vaccine or treatment for HMPV complicates efforts to control the virus's spread. The outbreak is a stark reminder of the vulnerability of even the most advanced healthcare systems to emerging infectious diseases. It underscores the importance of robust public health infrastructure, early detection systems, and transparent communication during health emergencies. Section 4. Global Preparedness. Lessons learned from COVID-19. The emergence of HMPV in China, 5 years after the start of the COVID-19 pandemic, raises critical questions about global preparedness for future outbreaks. The COVID-19 pandemic exposed vulnerabilities in global health systems and highlighted the need for greater investment in pandemic preparedness and response. The world has undoubtedly learned valuable lessons from the COVID-19 pandemic. We have a better understanding of how viruses spread, the importance of early detection and isolation, and the critical role of vaccines in preventing severe disease and death. However, the HMPV outbreak serves as a reminder that we cannot afford to be complacent. We must continue to invest in research and development of new vaccines and treatments for emerging infectious diseases. Strengthening global health surveillance systems is crucial to ensure the timely detection and reporting of outbreaks. This includes improving disease surveillance in animals, as many emerging infectious diseases, including COVID-19, are zoonotic in origin. Section 5. Staying vigilant, prevention, and informed action. In the face of the HMPV outbreak, it is essential to remain vigilant and protect ourselves and our communities. Preventive measures effective against COVID-19 can also help reduce the spread of HMPV. Frequent hand washing with soap and water for at least 20 seconds is crucial. If soap and water are unavailable, use alcohol-based hand sanitizers. Cover coughs and sneezes with a tissue or elbow to prevent spread. Dispose of used tissues immediately in a lined trash can. Avoid close contact with sick individuals. If unwell, stay home to prevent spreading the virus. Stay informed through credible sources like WHO and local health authorities. The emergence of HMPV reminds us of our vulnerability to infectious diseases. By learning from COVID-19, we can strengthen our defenses against future outbreaks.